All right, we are recording. And we want to welcome everyone to the second Equine Health webinar in our 2022 series. These webinars are brought to you in partnership with Michigan State University's College of Veterinary Medicine and My Horse University, an online horse management program based in Michigan State University Extension. During this presentation, you can use the Q&A tab to type in questions and press send. If you are joining us from Facebook, please type your questions in the comment section. If a question isn't answered right away, Dr. Parks will field questions at the end of the presentation. Dr. Julie Strakota is a MSU equine veterinarian and is the lead in developing this webinar series. Julie is going to introduce our presenter for this evening.
Thank you, Chris. So I am really excited and honored that we get to have Dr. Andy Parks tonight present the equine foot, an overview. So Dr. Parks is a professor of large animal surgery at the University of Georgia. He was an equine surgery resident here at Michigan State University. His clinical interests have been in equine lameness, particularly that related to the foot and abdominal surgery. As an instructor at the University of Georgia, he has been responsible for teaching surgical techniques as they apply to all species and lameness in horses. He has also taught lameness and abdominal surgery in cattle. Welcome, Dr. Parks.
Julie, thank you for your kind introduction. I'm not sure I'll be able to see the questions as I come in because I'm working on my iPad and using the screen mirroring, but I will certainly catch them all at the end. Anyhow, I consider myself fortunate to have been a resident with both Frank Nichols and John Stick at Michigan State University, and they were a great influence on me. And Dr. Nichols in particular knows an enormous amount about horse feet. So what do we mean by the foot? Let's start there. And most veterinarians, from an anatomic point of view, it doesn't really have a corollary with our own feet, but most veterinarians would consider everything below the coronary band, everything below the coronary band to be, and I will endeavor, I'm going to have a little bit of, I was thinking that this would work, but yeah, everything below that line. In other words, everything below the coronet is the foot. But when vets say there's problems in the foot, a lot of the times they actually mean that it blocks out with a block just below the fetlock. And that means that it gets everything, all this area here, but that's really the digit rather than the foot. And a lot of the times we're talking about the digit because there's structures that are inside the foot and there's structures that are above the foot. And so it's hard to separate them. Anyhow, let's talk about what we're going to talk about this evening. So depending on how I do for time, I've already talked about what the foot, I want to talk about the structures in it and what they do. Then let's talk a little bit about things that go wrong. And then let's figure out what is wrong. Let's figure out how we look to see what is wrong. And if we have time, then we can do a little bit of first aid. But I would like to say, I think the horse's foot is incredibly interesting. I mean, something that can travel, an animal that can travel at 30 to 40 miles an hour and land on a disc that is 4.5 inches in diameter and it doesn't all break is reason enough to be fascinated by it. Because it lands, the horse can land on a single foot with a force approximately equivalent to 2.5 times its own weight. So let's start with on the inside and we'll work our way out. I like to think of it really as a mechanical system. It is, of course, a biomechanical system. And bones transmit force. They're not the only thing that transmits force, but they transmit force in compression. In other words, they allow an animal to stand up. And, you know, this here, this is obviously the cannon bone. This is the long pastern, and this is a short pastern. And the pastern bones are just long bones, which means they're modified cylinders, and they're very well adapted to compressive stress, but they're not so well adapted to bending or rotation. The coffin bone, distal phalanx, whatever you like to call it, is very different. It's not a cylinder at all. It's basically sort of a triangle in 3 dimensions, and it has various surfaces, but the most obvious one of which is this surface right here. Notice it's very rough and irregular, and that means it's really well adapted to attachment of soft tissues, which are the lamellae, and we'll talk a little bit more about the lamellae in the future. Of course, there's an articular surface here that forms the joint that it interacts with that short pastern. And in this image here on the right here, you can see that the navicular bone and the coffin bone, and this is the navicular bone right here, they form a cup, and that distal end, that bottom end of the middle phalanx sits inside that cup. And so that navicular bone, and navicular is a word that almost all horse owners know quite well, acts as an extension, a palmar extension out the back of the foot. There's one other interesting structure about the horse's foot that is not really common in our other domestic animals, and that is this thing called the collateral or ungual cartilage. And if the line of the hoof is right about here, you can see it sits half above the hoof and half below the hoof. And its function is thought to be related to absorption of energy. It can sort of, I like to think about it as a flexible extension of the bone, which allows the foot to expand, but that would just be me hypothesizing. So we have a bony structure, and we've got all our bones, and they have to articulate, and they articulate with joints. And so we've got several joints here. This would be the metacarpophalangeal or fetlock joint. And these two would be the two, one's the pastern joint. So this would be the pastern joint, and this would be the coffin joint down here. Notice that they're quite large. You know, they've got big pockets of fluid that extend up and down. So now we've got bones. They provide the rigid structure. The joints provide the means for motion between those bones, but still we need something to hold things together. And the things that hold bones together are ligaments. And they're the same things that you hurt when you roll your ankle if you've been playing flag football. And the most important ones are these 3 sets of collateral ligaments, because without those, the cannon bone, the long pastern, the short pastern, and the coffin bone wouldn't be attached to each other. There's really quite a lot of other ligaments. There's ligaments that hold up the navicular bone. There's ligaments that hold the sesamoids in place behind the back of the fetlock. So now it's all held together, but we still have to make it move. And, you know, if we resort to the mechanical model, you know, there's usually an engine. The engine would be the muscles. And when the engine isn't right next to the structure that it's causing to move, we have to have some sort of pulley system. And that pulley system are the tendons. And there happen to be sort of really 4 main tendons in the suspensory ligament in the bottom end of the leg. And in the front leg, this would be the common digital extensor tendon, And this one here is the lateral digital extensor tendon. All right, there's 2 flexor tendons on the back side of the leg. They're the common digital, the deep digital flexor and the superficial digital flexor. And then there's the branches of the suspensory ligament. So it's all held together, and it needs nutrition. It's a living structure. It needs nutrition. And the nutrition and the waste product removal are through these palmar digital vessels. And these would be these. These are the palmar digital arteries, but there's a corresponding set of palmar digital veins. And you can see that there's quite a network of these vessels around the coronary band. This would be the coronary band, and then around the base of the solar margin here, which would be the circumflex artery there. So we have a great blood supply down in the bottom of the foot, and we have a great venous drainage. And they become very important when horses get diseases like laminitis. But we also have to have a way to control it. A crane operator knows where, you know, he's operating the controls, and he knows where the object that he's moving is around. The horse has, just like you and I do, has nerves in its legs that tell you where your leg is. You don't need to see where your leg is to know where it is. And the same thing goes for a horse. So we have these sets of nerves, the palmar digital nerve, the dorsal branch of the palmar nerve here, and the palmar nerve itself is just right up there. And they provide sensation, but they also provide, so, you know, if you tread on something that hurts, they'll tell the animal that, so they can convey pain and they can convey position of structures. They're very important in preventing the animal, or at least as an early warning when the animals get sore, and for telling the animal how to move. But the most interesting thing about the horse's foot is really its hoof. And the hoof is actually the skin of the foot. It's all the layers. So this is actually here. Here we have a piece of skin of the horse's nose. And this layer here, bear with me. This layer here is the epidermis. This layer here is the dermis, and down here you have the subcutaneous tissue. So it's composed of three main layers, just like your skin is and our skin is. On the nose, of course, there's all these little structures like hair follicles and glands and things like that. On the right here, we have a close-up of the epidermis. So this is the close-up of the epidermis, and you can see at the bottom here, the cells move up like this, just like your nails move up, to be honest with you, or your skin exfoliates. They move up to this. So this is up here is firm and this is firm and dry, and this is moist and got lots of nerve endings in it. So the horse's hoof has all of those different layers, but it's really interesting. So much like, you know, the skin around your nail is very different. Your nail is just the equivalent of a hoof, right? And the skin around it and the skin that it's made of are very different to the skin on your arm. Well, same is true for the horse's hoof. And each of these colors in this picture represents a different type of tissue that forms the skin of the hoof. So these three here, I will get used to this, but these three here form the coronary band. This one here forms the lamellae. This one here forms the sole, and this one here forms the frog. And as you know, anyone who's looked at lots of horses' feet knows those areas are quite different. And they're different because they're made of different tissues. All right, so this is a snapshot right here on the top left. This is a snapshot, a fancy histological image of the horse's coronary band. It doesn't include it all because you can't fit it all, or the details don't show. But the coronary band generates horn tubules, and those an intertubular horn, and those horn tubules and intertubular horn provide the strength of a normal hoof wall. The normal hoof wall is actually quite fascinating. This would be the outside, and this would be the inside. And you can see, this is obviously a dramatic representation, but the tubules change shape, size, structure, and density from the outside to the inside. And that represents a change in the strength and the qualities of the hoof inside. The horn in between, by the way, is also different from inside to outside. The inside is 100% hydrated. The outside is probably 75% dehydrated. The outside here is very stiff, and inside here is very flexible. And that provides a lot of protection for the inside structures of the horse's foot. So this is a section, the last section was from here. This section is taken from right here. So that represents that. And whereas it forms tubules at the coronary band, these little leaf-like structures are called lamellae. And you can see that there's a big lamella here right? There's a big lamella there. And along the sides, there's lots and lots and lots of little ones for each of these structures. There's about 500 or 600 of these big lamellae all the way around the horse's hoof. And each one has 100 to 200 little ones. And they greatly increase the surface area. And therefore, they increase the attachment of the hoof capsule to the underlying structures. It's incredibly strong. And that's what enables horses to do what they do without the horse's hoof coming off the foot. And it's the structure that gets damaged in horses with laminitis. So, you know, all the brown stuff on the left is horn, and all the gray, slightly bluish stuff on the right is the dermis and subcutaneous tissue of this piece of the horse's foot. You can see the cross sections of horn tubules on the far left of this image. Here, there's lots of little horn tubules everywhere. So those are the pieces and parts. What is the normal shape of a horse's foot? Well, just like us, there's actually sort of no absolute normal or perfect shape. And there are probably some shapes are better for some sort of performance than other shapes. But there's a sort of a traditional idea as to what things should be like. And the number one thing is, we'll start with the image on the left. And you can see there's these two red dotted lines on the image on the left here. And then this one, and this one. And ideally, they should be parallel. And there's reasonable evidence to suggest that that's true. We call that, by the way, the foot pastern axis, or FPA. And they should be parallel. Also in this image, you can see there's a relative position of the ground surface of the foot in relation to the axis of the cannon bone. Problems occur if the foot is too far forward or if the foot is too far back. And you can see if you drop a line down the middle of the cannon bone, it roughly hits the ground where the back of the foot is. If we go to the image in the middle, you can see that the distal limb is roughly symmetrical. I say roughly, this is an idealized image, and it is symmetrical. But in the real world, it's not quite as symmetrical as that. And if you drew a line across any 2 points on the bottom of the foot or any 2 points across the coronary band, the traditional idea is to think that those two lines should be perpendicular and form a right angle with a line that splits the foot in two halves, like that. Again, it's a good starting point, but it's not always 100% true. And lastly, if we look at the image on the right, again, looking from the bottom, classically, the foot is considered to be about equal medial or inside and outside halves. We actually know that that's not always the case, and the outside half is very slightly larger than the inside half, but that difference is hard to detect with your eye. We also know that a good-looking foot is roughly as long as it is wide, or I perhaps should say as roughly as wide as it is long, because you don't often see horses' feet that are wider than they are long, but it's pretty common to see horses' feet that are longer than they are wide. And in the middle of it all sits the frog, which is relatively symmetrical. And there's many things proposed for it, but it at least allows the two sides of the foot to expand. And the foot does expand minorly, but it does. As the sides go out, every time the animal bears weight, it moves out just a little bit. All right, quickly, we'll talk about some properties of the hoof wall. It's viscoelastic. It means it behaves both like putty and it behaves like rubber. You know, when you hit a rubber block with a hammer, it bounces off. And the hoof wall does the same thing. That's what allows a horse to land and deform its hoof, and it restores immediately when it's moving at pace. But if you put a big weight on one side of the hoof and leave it there for a long time, it kind of leaves a dent, and that dent will then slowly go away. That dent is caused by viscous motion. It's rather like the toothpaste in a toothpaste tube. If you squeeze the middle, the toothpaste is pushed to either end. But if the tube is elastic, eventually it'll be restored back to its normal shape. And one of the things that we'll talk about briefly when we talk about examination of the foot is how the horse's foot responds to abnormal stress. Normally, as in this picture on the top left, the horse is growing at roughly an even rate, not evil, all the way around its foot. But when you stress it, you cause bits of, you can cause some distortion. And in response to that distortion, the animal slows its growth rate down. It will also develop flares, and I'll show you pictures of those later on. So the animal responds to abnormal stress in 3 ways. The horse, it gets, it changes shape, it changes its growth rate, and it develops these flares. So what does the horse's foot have to do? It has to support the weight of the horse, it has to facilitate locomotion, and it has to absorb energy of impact. So let's just think about how it bears weight. This isn't uncontroversial and not proven, but I think the evidence for it is reasonable. And that is think of the horse's coffin bone suspended inside the hoof capsule by those lamellae, those leaf-like structures that I showed you on an earlier image. And you can see that they're represented here by those little red lines like this. And you can see that they're on 3 sides. And on the back side, there is this big tendon, the deep digital flexor tendon. And so that's pulling up from the back, and the little red lamellae are pulling up all the way around the horse's foot. And so that sort of holds the horse's foot, holds the coffin bone inside the foot up and off the ground. You can I have actually removed the whole sole of a horse's foot, and that horse can still stand on it, though I wouldn't like to walk over pebbles and things. So that's for the animal standing there. What about what happens when it moves? And the reason the phases of the stride are a little bit important is different injuries can occur at different points in the stride. But we split the stride into the stance phase and the flight phase of the stride. And we further break down the stance phase of the stride into 3 or 4. Here I just have put 3 phases, but one is impact, and it's relatively short, the first few milliseconds, the first 10–15% of the stride when the foot hits the ground. Then there's a support phase of the stride when there's maximum weight on it. And you can see that there's maximum weight because it's really bent here and it's bent here. And then there's breakover. We define breakover as the time between when the heel comes off the ground and when the toe comes off the ground. Once the toe has come off the ground, then it's in the flight phase of the stride. But there's different things happen at different phases of the stride, and the animal has different ways of handling them. So how does the animal absorb this force of impact? I said it can land with a force of about 2.5 times its body weight at a gallop. And there are lots of structures inside the horse's foot that can absorb energy. Probably the big one, of course, is the hoof itself. I've told you that it is very stiff out here and it's very flexible in here. And that flexible zone between the outer rigid hoof and the rigid coffin bone underneath allows quite a bit of motion and dampens the stress, dampens the forces, the shock waves essentially that happen to the bottom of the foot, and so that it diminishes them arriving there. But there are other things. And one of them, Dr. Bauker from Michigan State has published quite widely on this. And that is, there are these cartilages that I pointed out earlier on. And notice that they've got these red splotches inside. Those are vessels. And so there's a potential hemodynamic mechanism by which the animal absorbs energy. This structure here is the inside of the frog. It's called the digital cushion. That is also fibroelastic, and that can absorb energy. There's lots of cartilage in the joint here and here. You can see this. And that can also absorb some energy. So that the energy of impact, the shock waves of impact, while they're quite significant at the bottom of the foot, barely get to the fetlock. In other words, the horse has an incredible damping mechanism. During this is the breakover phase of the stride. And the thing about the breakover phase of the stride is the stresses are different, but the lever arm at the toe is very long. And that puts a lot of strain on the distal part of the deep digital flexor tendon and the check ligament. So I've mentioned the beginning and the end of the stride. I should also mention what happens at the middle of the stride, where this joint is like this and this joint is like this. And that's when there's maximal weight bearing, and that's when there's maximal stretching of the superficial digital flexor and the suspensory ligament. And so you can see that at the beginning of the stride, it could be injured from vibrations. In the middle of the stride, it could be injured. The tendons could be injured from those tremendous forces associated with maximal weight bearing. And then at breakover, you've got this very long, you've got a long toe, you've got a long lever arm. It puts a lot of stress on the tendon there. And that stress not only pushes on a tendon, but then it also pushes on a navicular bone like this. So those are the structures. That's how it works. So what goes wrong? Because if we're going to try and make a diagnosis, it's a good idea to have an idea of what sort of things go wrong. And I kind of like a relatively simple approach. There's only so many bones, there's only so many structures, and these are all the structures. Whoa. These here are all the structures that are in the horse's foot. And some of them are more likely to be injured than others, so all of them can be injured. And there's only so many things that actually can go wrong. And some of them I'll discuss are much more common than others. And you can see that you can sort of draw lines across like this. But the main thing here is that the most common ones of all of these are these three. Neoplasia or cancer in the horse's foot is pretty uncommon. Those would be the big ones, and they affect many of the structures inside the foot. Trauma can affect essentially anything, and I'll show you some examples later. So let's go to infection. There are sort of, basically, I'm going to split it into infection of the hoof and infections of inside the hoof. So this picture on the left, here, this animal had a pad on for a long time, and it probably had some silicone under that pad, and it had a prolonged amount of moisture. And you can see that the frog is quite damaged. And that is what happens when presumably gram-negative and anaerobic bacteria get to multiply, and they cause the frog to degenerate. In the middle here, we have a horse with canker. And this used to be very common in draft horses. And it basically, again, it starts in the same sort of area that thrush does. But the bottom line is thrush starts on the outside. This tends to get in deep and work out. So they're quite different. Thrush seldom goes lame. Canker often go moderately lame. And lastly, here's an abscess. Here's an abscess, and you can see some pus coming out of a crack in the white line. And that is also basically infection of the hoof and not the deeper structures inside the hoof. But there are some things when it's pretty obvious you've got some things going wrong inside the hoof, and sometimes they're not so obvious. And I don't have time to go over all the different examples, but the slide on the left, obviously there's a tremendous amount of swelling here, 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 and here. And not only that, but there's this draining tract right there, a big draining tract. And that is infection of the collateral cartilage. The one on the right, you've got a whole lot of swelling on the front of the hoof. This one has been allowed to go too long, by the way, but there's a whole lot of swelling on the front of the hoof. There's one main structure right under that, and that's the coffin joint. A lot of them are a lot more subtle than that, and when they're early, you don't see anything on the outside. But it doesn't take too long to see something on the inside when something on the inside causes a change on the outside. It depends on the structure, of course. All right. Single episodes of trauma. On the bottom left, we've got a nice example of a fracture line right down the middle of the coffin bone. I have to say that these are not particularly common in my neck of the woods, and I didn't see very many of them when I was at Michigan State. I actually did see quite a lot when I was an intern in the United Kingdom. And, you know, sometimes a horse just has to stamp its foot down too hard, but it's pretty rare. They're very tough. On the right is a hoof wall. This is a hoof wall avulsion. And you can see a whole piece of hoof wall has been lifted off the underlying structures. But there's various other sorts of trauma, but those are really good examples of single acute trauma. And we tend to think of trauma as single acute, you know, falling off your bicycle. We don't think of shin splints so much as being trauma, but they are. Shin splints are a recurrent low-grade trauma. And horses get the equivalent injuries, and they get them all over the place. They do get buck shins, but that's not in the foot. But hoof cracks, and this here is a really nice example of a hoof crack that has been caused by too much stress on the inside. And if you look at the coronary band here, you can see how there's that great big bump. That bump means that there's been too much stress on that wall right there. And that stress has caused the wall to fold a little bit and crack. Down on the bottom here, you can see this is a deep digital flexor tendon. And here is a hole in the deep digital flexor tendon caused by excessive trauma. Two other examples on the radiographs. Right here, you can see evidence of lysis around the navicular bone. This animal has really bad navicular disease. You should have a nice black middle of the bone. The whole bone looks white, and it should have a nice clean rim. You see how it's clean right here? That's really nice and clean. It gets all fuzzy right here. The fuzziness is abnormal. On the bottom right here, we have a horse with Paston arthritis or DJD, and you can see right here and right here, new bone forming as the animal attempts to stabilize a damaged joint. This animal would have been extremely lame, very uncomfortable. All right, so sometimes we get trauma and infection. On the bottom right, you can see that's a roofing nail, and it's penetrated the frog, it's penetrated the deep digital flexor tendon, and it's got all the way up to the back of that navicular bone and towards the coffin joint and navicular bursa. On the left, we've got on the left here, you've got apparent exudate exiting a small wound in that groove or sulcus between the frog and the sole of the foot. When nails go in there, it's often very, very hard to find the entry point. And if it goes through the frog itself, because the frog is very rubbery, often the wound will close right over. And when you get infection inside the hoof capsule, because the hoof capsule doesn't expand or contract very much, a small amount of fluid causes a dramatic increase in pressure. And that dramatic increase in pressure means that they get much lamer than a comparable injury elsewhere on the limb. So this is a nasty thing to happen, and sometimes can be difficult to find depending on the structure involved. The consequences can be quite severe. Okay, so this is the last of these conditions, which doesn't really fit into the trauma, though trauma can cause it. Doesn't fit into my original three, so infection, degeneration, or trauma. This is probably an inflammatory disorder, but there's multiple pathways into an inflammatory or an endocrinologic disorder, but there's multiple pathways into this disease. But the bottom line is those leaves that I showed you earlier on are called the lamellae, and that are called the lamellae, their attachment to the hoof breaks down. This image on the top here, this one here, I'm making a mullock of this, aren't I? But this one here, this is a young racehorse that actually had colic surgery and got colitis and got extreme toxemia. And it's very early. You can see the damage, obviously, all that dark red hemorrhagic tissue is the damage. The lamellae are completely damaged. What you can see is what the consequences of that are. If that's allowed, that animal's allowed to persist like that, the likelihood is the coffin bone will rotate inside the hoof capsule, and then you get this distraction. So the one on the bottom left here is exactly what happens. So this one here, you can see there's this great big gap now between the coffin bone and the hoof wall. And that's what happens when they rotate. And notice only also this. Notice how thin the sole is there compared with how thick the sole was in the one that hadn't rotated yet. So the main features of that rotation are the coffin bone moves down and backwards and the sole gets very thin. You can tell, by the way, that that one on the left is relatively, it hasn't been going months and months, but it has definitely been going more than a week or two. And the reason we know it hasn't been going months and months is the hoof wall is still relatively straight. This is relatively straight here still. Look at the one on the bottom right, and now you can see there's a whole lot of things going on here. This hoof here is, there's nothing straight about that anymore. We know this has been going for a very long time. We know that for multiple reasons. You've still got this wedge of stuff right here, right? And notice the tip of the coffin bone, it's been eaten away there. So that one's been going a very long time. And so these are 3 stages, sort of acute, subacute, and chronic laminitis, a really nasty disease. Here are the radiographs, and these are radiographs. The one on the bottom left here is very much like the middle one of the 2 I showed you just earlier on. And the one at the bottom right, the top right here, is very much like the one on the bottom right. It has the, if you could see, I apologize for this, but the hoof probably came out here at one point in time, but someone has trimmed it off. And so you can see that there's a lot of damage that's been severe and gone for a very long time. All right, so we have looked at the structure, we've looked at how it works, and we have looked at a few things that can go wrong. So how do we figure out which of those things are causing the problem and what is the process? And we do that by collecting a history and a physical exam. But before we talk about those, let's just talk about inflammation, because most of the things that make animals go severely lame are associated with inflammation. And the cardinal signs of inflammation are pain, swelling, heat, and where the skin is pink, discoloration, and change in function. And the other thing that's important to remember is that if it happened 2 days ago, it's going to be very different to if it happened 2 months ago. So acute is often going to look different to chronic. Acute is often going to be a lot hotter, and the swelling is going to be pit. You know, you put your finger in it and it makes a dent. When it's been going for a long time, it's not going to be as warm. Any swelling is going to be very hard. So there's a big difference. So these things help us. Very briefly, why is the foot different to other structures in a limb? Well, number one thing is the rigidity of the hoof capsule. I mentioned that when you inject a little bit of fluid in there, it can't expand, so pressure increases dramatically, and that magnifies the pain. And also, the hoof doesn't let you look through it, so things can be difficult to detect. It also changes shape because it's a constantly growing structure, and it responds to stress. So how do we find out what is going wrong? We can do a history and a physical exam. The history, there's 4 or 5 basic questions, and then there's a whole bunch of other questions that can be related to those 5. So the important ones are, you know, when did it start? How long has it been going? How has it been going? Is it getting worse? Is it getting better? Does it come and go? Does it respond to treatment? And if so, how did it respond to treatment? And then we got to do a physical exam. Chris and Julie, you may have to nudge me with time. I notice I've probably been going about 30 minutes. Okay, so the first thing to do is don't jump on the foot. Look at the whole horse first. This is a classical stance of a horse with laminitis, but there's lots of things you can get from it. You can, you know, if there's shavings on the flanks, you know it's been lying down, for example. But look at the whole horse. When you look at the foot, it's really hard to tell much about a really dirty foot. Clean it up with a good wire brush. Okay, so there's 4 or 5 things. I think of this as being the 5 simple things you can do to find the majority of obvious things on a horse's foot. And this is appearance. The top left, this is strictly a conformational issue here. In other words, I told you about the hoof pastern axis. Notice that they're not straight. They're going to cross. That means it's predisposed. Its heels are probably taking too much strain, and its deep flexor is probably taking too much strain. The one on the bottom left, I've already shown you. This animal has a lot of swelling above the coronary band, and it's got a discharging sinus. So the one on the top tells you something might happen. The one on the bottom, something definitely is happening. And the one on the bottom right, this is the white line here, and it should be, you know, a 1/16 of an inch wide, and you can see it's over a 1/4 of an inch wide. That tells you this animal had laminitis in the past. Those little striations you see, by the way, they're horny lamellae. So you can see what it had in the past. The other thing is the distortions of the foot. I've already talked a little bit about the growth rings, but I mentioned flares, but I didn't show you what a flare looks like. This is a flare. This animal has a flare. It's bending. The wall is bending. Notice the other wall, by the way, is also running under. So the stress changes. Down here, notice this heel bulb is moving forwards and this toe is pushing out. So these distortions are the consequence of too much stress. All right, palpation. Palpation is important. The first thing you should do is feel how warm it is really quickly, because the minute you've had your hand on it, for any length of time, you've changed the surface temperature. You can feel if it's got a digital pulse. My 2 fingers on the right image, they're over the palmar digital artery, and I'm trying to see if the animal has an exaggerated pulse, because that means there's more blood flow to the foot. And when there's inflammation, there's usually more blood flow to the foot. You can also feel if the tissues are soft or hard this way. So we can do palpation. We can manipulate it. One of the things that horses with arthritis have is they object to being manipulated. So you can flex and extend the joints. You can even rotate the coffin bone back and forward a little bit. But this is very valuable, particularly in conjunction with watching the animal move. One of the things that all vets do are going to put a pair of hoof testers on the foot if they think that this is a problem. And they're going to, basically, they're going to squeeze the tissues between the jaws of the instrument. And if they elicit a painful response, it's indicative of a problem going on inside. There are some caveats here. The first caveat is any horse may respond the first time. And the other response is you know, if the veterinarian is also a bodybuilder, he may be strong enough to actually squeeze that foot hard enough that all horses could hurt. But obviously most horse owners do not have a hoof tester, but you do have a hammer. And if you had a horse with laminitis and you gently tap the hoof wall, if it's severe enough, it's going to tell you something is going on. Lastly is pairing. Now I put this in parentheses because all of the others, you as an owner can do, to be honest with you. I mean, you don't have hoof testers, but you should have something you can tap the hoof with. But pairing is something that should largely be restricted to a farrier or a veterinarian. I mean, if you've been trimming your own horse feet, that's fine. But the goal is just, you know, depending on what you've got, clean the horse's foot out. If I'm going to do an extensive lameness exam, like blocking the horse out, I will not do this at this stage. But if the horse is lame enough and I'm not going to move the horse around a lot, then this is where I'll go. And, you know, I'm just cleaning on the left, I'm just cleaning the bottom of the foot to see if there's any black marks. The slide on the top right, you have obviously got a large amount of hemorrhage right here. You've got all that hemorrhage in the white line and just inside it. That's blood that has seeped into the horn tubules of the sole and the adjacent lamellae. That animal has probably had lamellar trauma at some point in time. And the one on the bottom actually belonged to, one on the bottom here actually belonged to one of our staff. And that animal had trodden on a roofing nail. And you can see that having trimmed the frog, you can see the point of puncture by the roofing nail itself. So the last piece of this sort of basic exam is have a quick look at the shoes just to see how they wear, okay? Because they tell you something about the horse's moving, whether it's favoring something or not. Most horses are going to wear the outside toe slightly more, and Here you can see that there's more wear in this area here, from here to here, than there is elsewhere around the shoe. On this bottom one, you can see the hoof wall is hanging out over the edge of the shoe. And that means the shoe has moved forward and the shoe has been on a long time. And that's also an issue and potentially would lead to bruising between the sulcus and the wall, often called the angle of the sole. So check for the shoes, and you want to know what type they are, of course, and whether they fit properly and how they're worn. And then lastly, let's watch the animal move. And from our point of view, rather than just talking about watching whether the horse's head is bobbing up and down, we're going to look at how the horse lands. And you can't do this very well with your naked eye with the animal trotting. So you need to watch them walk. Watch them from the side, and from the side you can tell if they're landing toe first or heel first. And from behind, you can see if they land outside first or inside first or flat. Most horses land slightly on the outside of their feet, somewhere between the quarter and the heels. Some horses land flat, but the two patterns that are more indicative of something that's not right are if they land heavily on the inside of their foot or they land heavily on their toe. Once we've done all that, we can block them and then we can image them. And I've shown you some of these sorts of images before. The top left is, I've shown you an image very similar to that one. That's severe arthritis associated with the joint capsule of the distal interphalangeal joint. On the top right here, there's this lesion all the way around here. That's a big hole in that horse's navicular bone on a radiograph. Down here on the bottom left, here you've got a bone scan, and you notice that one area is very dark. There's a lot of uptake where that thing is. Bone scans are very sensitive, but they're not very specific. In other words, it tells you something's going on there, but it doesn't tell you what. Could be a fracture, could be a damage to the collateral ligament, but it tells you you've got to go look with something else. So radiographs, very good detail of the architecture, but they don't tell you how active it is. The bone scan tells you incredibly well how active it is for bones. It doesn't do so good for soft tissues, but it doesn't tell you exactly what it is. In the middle, we've got a tear in the deep digital flexor tendon here, right there. And on the bottom right, you've got a comparable image to the, this is a MRI. And here we have a big old hole in the navicular bone, very comparable to the one that's in the radiograph above it. I hope I'm doing okay. I wanted to just say a word or two about foot wellness. You know, the foot is obviously going to be softer, more prone to trauma, and more prone to superficial infection if the animal is in perpetually wet environments, particularly if there's contamination, particularly if there's fecal contamination in that environment. So, you know, if you pick them out regularly, and if it's advisable to have them overgrowth of the foot, in other words, they can't naturally wear, in circumstances where they can't naturally wear, overgrowth is a potential problem. So under those circumstances, either trim or shoe regularly. Always vaccinate your horses for tetanus, because any injury, no matter where it is, once it's entered the soft tissues underneath the hoof, is potentially a source of tetanus. And, you know, be careful and good observers of the shape and texture of your horse's hooves. So here we are, just when to call a vet. And, you know, I would say that most horses come to us, they come, if they're have an abrupt onset of severe lameness, then we're likely to see them. And there's lots of differentials for severe lameness, but abscess is the most common, always. But then fractures, tendon strains, and sprains of ligaments, infection, nail punctures, laminitis can all make an animal go quite lame in a matter of hours to a couple of days. And those are always a really good reason to call a vet. Much more mild problems, some of those are going to fix themselves, but persistent mild to moderate lameness problems, then there's probably some more enduring problem going on underneath, and it warrants examination by a veterinarian. Chris and Julie, how am I doing on time?
Dr. Parks, I don't know how much more you have, but now might be a great time to stop and let our participants put in their questions in the
Okay, so
Q&A
I have
box.
one last, I have myself an eject button here, and if I press that, it'll take me to my
Perfect.
last slide.
Let's do it.
Oh, I thought it would. I was just going to talk about, I thought it would. The link didn't work. Oh,
Oh,
well, the last slide was just a summary slide. And hang on a second. I'm not sure I can make it work. Oh, I have got to very quickly just go here. It doesn't want to do it now. It was just a summary slide. My other slides were just a couple of slides on, how to bandage feet and things. That's
Sure.
all.